So in this next section, I'll present the findings along the care pathway. So as has already been discussed, the two enquiries, the Black versus White and Asian versus White enquiries, looked at differences found between the quality of care provision for Black versus White women and Asian versus White women. All findings are based on information provided in the clinical notes and the consensus opinion of the multidisciplinary panel members, so do not include the women's voices or assessment of how their care was provided unless discussed with staff and recorded in their notes. So Ian showed you the overall summary scores in his talk at the beginning of this section. And these were the summary scores provided for each mother and each child dyad in the enquiries. And this table provides the grading of care at each point of the care pathway for the three ethnic groups. At the top, the Asian mothers, then in the middle, the Black mothers, and then at the bottom, the white mothers. And here we've highlighted the significant or major issues that were identified. And the darker blue represent the lowest proportions, and the darkest red, the highest values. So you can see in the most red or the pink areas, those are the areas where the most significant and major issues were found. And as you can see, they're fairly well spread between the ethnicities presented. And in the next slides, I'll present the details of the findings along the care pathway. So starting with antenatal care. In terms of antenatal care, the highest proportion of significant or major issues were identified in Black women with 84%, in Asian women 73%, and in white women 69%. So the next few slides will detail the specific issues identified for the different groups. So we all know that GTT should be offered to women from ethnicities with a high prevalence of diabetes, as well as a range of other factors. And on this slide, it shows that oral glucose tolerance tests were not offered to more eligible Asian mothers, 22%, and Black women, 29%, when compared with white women, where only 3% of women in the white category who were eligible for an oral glucose tolerance test were not offered one. High-dose vitamin D is recommended during pregnancy for women with pigmented skin, as well as a range of other factors, including reduced sun exposure and obesity. And here we show there was a failure to follow national vitamin D guidance for all Black and white and most Asian eligible women in the review. So it's 90% of Asian women and 100% of Black and white women. The impact of this was far greater for Asian and Black women, as they are all eligible for high-dose vitamin D, compared with only a small proportion of white women. We also know that the risk of chromosome anomaly is increased in consanguineous relationships, and this is a very sensitive issue for the Asian community. And we see here that the uptake of antenatal screening for chromosomal conditions was lower in the Asian population, with only 35% of Asian women, declining this screening compared to only 6% of white women. And data from the standardised checklist was used for the enquiry, and that's been described by Ian earlier. And there were other issues that were also highlighted using that data. Two further examples were poor management of hypertension. This was noted in the care of 3 Black women, but no white women were identified with the issue. And the provision of information about reduced fetal movements was less common for Black women, 47%, compared with white women, 58%. Moving on to labour and birth. So we can see here at the bottom, summarised from the graph, major or significant issues were found for 47% of Black women, 56% of Asian women, and 52% of white women. Where there was sufficient time, there was no evidence of a partogram being completed for almost twice as many black women compared to white women, 64% versus 36%. And we all know that it is as important to complete a partogram for all pregnancies, irrespective of whether the baby has survived or not. So it may be that in a number of the women where the baby was stillborn, there was a feeling that the partogram wasn't as important, but we know that that is not the case. When pain relief was requested during labour, there were similar proportions of women who did not receive pain relief within 15 minutes. That was 27% of black women and 35% of white women. And that's an issue that has previously been put forward as a particular problem for the black population. Panels did not identify any specific differences between the quality of intrapartum care provided for Asian mothers and that provided for white mothers. Moving on to neonatal care and care at resuscitation. We found that the standard of neonatal care provision was similar across the board for Asian, black and white babies. We found suboptimal neonatal care in around half of all stillbirths and neonatal deaths in the inquiry. And when I mention stillbirths here, I mean stillbirths who were alive at the onset of labour and possibly had some neonatal intervention. So you can see that 7 out of 15 babies born to Asian women had suboptimal neonatal care identified, ranging from 1 issue to 15 issues per baby. For the black mothers, 3 out of 6 babies born, with a number of issues ranging from 3 to 10 per baby. And for the white mothers, 4 out of 8 babies born to white mothers, with a number of issues ranging from 2 to 12 per baby. And the suboptimal neonatal care that we identified at the confidential inquiries mirrors that's been highlighted in previous work that we've carried out in the area and previous work from independent reviews of perinatal services. And these are the fact that the most common issue identified related to clinical management, and that was particularly around resuscitation and early thermal care. These were compounded by failure to seek or have access to prompt senior support. There was a lack of team leadership, including taking a helicopter view in a situation where you needed to take a step back of the case, and expediting specialist referral was felt to have contributed significantly to the outcome in several cases. So it really is important that even in a very serious situation where many, many things are happening, it's important for someone to take a step back and look at the whole case and work out what to do, taking everything into consideration. There were numerous instances also of poor documentation, particularly in prescribing. So moving on to ongoing care or postnatal care and bereavement care. Here we found major or significant issues for 34% of black women, 45% of Asian women, and 55% of white women. So we know that we should be providing compassionate, sensitive, personalised and parent-centred care, because this can help families come to terms with their loss and prepare for any future pregnancies that they may want to go on to have. The goal is to offer the same level and quality of care to all parents who've experienced a perinatal loss across the UK, irrespective of their age, their ethnicity, or any other factor that the parent may have. Panels identified some differences in the expected standard of bereavement care, mainly accounted for by those who'd suffered a neonatal death. And we know sometimes that when a baby doesn't die until the neonatal period, it's slightly more complicated to get bereavement care sorted within the unit, because it tends to be sorted on the obstetric side. Medication for lactation suppression was more likely to be offered to and accepted by Asian women, that's 68% or almost over 2/3, and black women, where over 3/4 of black women were offered and accepted lactation suppression. However, in white women, it was less than half, 46%. Whilst bereavement photographs were offered to nearly all women, uptake was less likely to be taken up by the Asian women, and that was mainly where the baby had a congenital anomaly, and that's totally understandable. Moving on to pathology, major or significant issues were found for 2/3 of black mothers, 27% of Asian, and 46% of white. Postmortems were carried out for 18% of Asian babies. That was equivalent to six postmortems in the Asian population. And of those, one was a full postmortem and 2 were limited postmortems. There were a further 3 postmortems, which were all coroner's postmortems for Asian Pakistani babies, and none of the parents of babies of Asian, Indian, Pakistani or Bangladeshi actually gave their consent to a full or limited postmortem. Postmortems were carried out for 2/3 of black babies and just around half of white stillbirths and neonatal deaths. Placental histology was carried out for the vast majority of all the stillbirths and neonatal deaths that occurred in this inquiry, with 91% for the Asian, 92% for the black, and 85% for white stillbirths and neonatal deaths. Complete maternal and pregnancy information was provided for postmortem for only 1/3 of Asian babies and 13% of black babies, but none of the white babies, the information provided for those was not complete in any of these circumstances. Similar proportions of postmortem and placental histology reports were felt to be lacking an adequate clinico-pathological correlation for black mothers and babies, 1/4, and a similar proportion for white mothers and babies, 22%. So looking at the quality of postmortem and placental reports, and here for the Asian women, you can see that for the grading of the postmortem reports, there were only 3 cases looked at, and those were the cases where there was a full or limited postmortem, but they weren't the coroner's postmortems. So you can see that for 2 out of 3 of the postmortems carried out for the Asian women, the postmortem was graded as excellent or good. For the black women, the postmortems were graded as excellent or good for 57% of the cases, and for white women for 70% of the cases. And in terms of the placental histology reports, just over 50% of the for those carried out for Asian women were classified as excellent or good, 45% for the black women, and 55% for the white women. Moving on to follow-up, there were major or significant issues found for 3/4 of the black women, 65% of Asian women, and 66% of white women. In terms of follow-up appointments and letters, black parents were less likely to receive a follow-up letter directly addressed to them compared with white parents. That's 33% compared with 46%. Following stillbirth, follow-up letters were more likely to be addressed to the GP with a copy to parents for the Asian parents. That's 60% of cases, whereas this only occurred in 1/4 of the white parents. Future pregnancy plans or contraception were not discussed with 13 Asian women, 10 black women, and 12 white women at any point during their postnatal care. And 14 Asian, 9 black, and 10 white women did not have a follow-up appointment. For those parents where follow-up appointments did not happen, letters were either not written or were very medical in their nature, so very difficult for parents to understand what was being provided for them and how to plan their future care. So the overall findings were as follows. Major or significant issues were found for antenatal care provision for 3/4 of Asian women, over 80% of Black women, compared with around 70% of white women. 44% of Asian women, a third of Black women, and just over half of white women had major or significant care issues during postnatal and bereavement care. Just over a quarter of Asian mothers and babies, 2/3 of Black mothers and babies, and just under a half of white mothers and babies had major or significant issues identified with respect to pathology. And finally, 65% of Asian parents, 3/4 of Black parents, and 2/3 of white parents had major or significant issues identified at follow-up or review of their care and that of their babies. So in summary, the review panels identified a number of key issues along the care pathway where the quality of care provision differed between Asian and white and Black and white groups. But they also found quite a few areas where they were very similar. The differences highlight the need for ensuring all women receive personalised care, which is sensitive to their individual circumstances. And we feel that training should be developed to address this issue. So our recommendation from this section of the report was to develop training and resources for all maternity and neonatal staff so they can provide culturally and religiously sensitive care for all mothers and babies. And finally, I'd like to thank all of those who helped with the chapter writing that contributed towards this final chapter on care along the care pathway. So thank you very much.